Let's start. With no further ado, let me introduce you. Doctor, thank you for being here today.
Thank you
And
for
I want to
having me.
start, no, of course, I want to start first with you becoming a podiatrist. Where did this idea came and how did that transform into becoming more involved with public policy as well?
So I wanted to be a psychiatrist initially. And I remember my cousin's boyfriend, while they were studying for their bar, had a mental breakdown and ended up in my mom's hospital. My mother is a retired nurse. So my mother said, if this is what you want to do, you need to come see it. I had done some pre-medical programs and undergrad at the University of Miami, the U, and was excited. And I really couldn't handle it. It was not my cup of tea. And my mother and father were like, you just went on a full scholarship to University of Miami. You better figure it out quickly. My mother had hammertoe surgery at the time, and I got to meet her surgeon, who was a professor emeritus from my school, the New York College of Podiatric Medicine. And I couldn't believe it. I was like, I like this. And hence it was born. And he told me the benefits of going into it. He predicted that more women and more minorities would go into the field, and he was absolutely right. Pairing it with public and policy and health policy, from private practice, I used to volunteer for anything that I could under medical and health, from, the New York Marathon. I'm a member of the illustrious ladies of the Alpha Kappa Alpha Sorority Incorporated. I'm on the regional medical team. I have a show on blackdoctor.org called Stepping Forward with Dr. D, so that we can have these conversations outside of the office. No matter what the color, race, or creed of the podiatrist or medical provider, they are welcomed on the show. The platform is blackdoctor.org, which, it educates. I would say educates and entertains. What's a good word for that? Edutain the community. Because
Entertainment.
at 7 o'clock on a Wednesday, we're the first Wednesdays at 7. No one wants to be bored. They want to be like, if I'm looking into this, you're giving me good information. We've made our patrons laugh. When I think one of my colleagues they asked the question of, what do you listen to when you're in the operating room? One colleague said jazz, and the other one, who's a fool and a friend, said Cardi B. I mean, I think the commentary was like, what? And I said, yes, we're real people too, and silly at the same time. So that gives me joy to see that, I can give back to the community with good information and sound advice.
Great, great. And I love your sense of humor too, because most people have the perception that doctors are always serious and not, in taste to entertainment. But we see that you break, well, not that you break the mold, you fit the mold of having good humor as well. And, you have an organization. Tell us a little bit about that. And also, what is the mission?
So Sisters on the Vineyard is a 501c3. It's a solstice for health and wellness, financial literacy, and advocacy. And for me, it was initially came out of, I would say I made lemonade from lemons. I was diagnosed with stage 2B breast cancer in 2019, December of 2019. And this was a time where, when I was diagnosed, traumatic. You can hear more about it on my website, or you can even go to my YouTube channel to hear details. But I always said that if I would live, as COVID obviously was very big across our country, particularly in the Northeast, that I would do something. I would do something greater than just myself. And I started speaking for women's groups. I spoke for the Divine Nine organizations. I had the opportunity to speak on a virtual podcast for the United Nations, and I got to host a webinar on COVID for the North Atlantic region for the Alpha Kappa Alpha Sorority Incorporated. And I think with that, sometimes it takes a traumatic incident in your life to take you to the next step. So we've had these wonderful events on Martha's Vineyard in August, which is where a lot of African Americans come historically in the month of August. And we said, if you're there and enjoying yourself, why not get great information by the best and brightest in health and wellness, financial literacy, and advocacy? Our past speakers have been Sunny Hostin from ABC's The View, Tamika Mallory, the activist and author, and of course, the lovely Malik Yoba, which He's the one who educates and makes us laugh because he's a very, very big proponent of health. And we've now had our first event in New York City, and we just keep moving and grooving. Sisters in the Vineyard is under, I guess, my umbrella, Talks with Dr. D. So it's something that will keep growing, God willing, year after year.
That's amazing. So you took an opportunity, especially when you were the most vulnerable, and then you made something out of it. And this talks a lot about your bravery. So this bravery is translated into speaking up for healthcare equity.
Mhm.
Why is this so important to you, and what opened the umbrella to get into this field?
I would say my ethical anchor is my proximity to the patient. You know, I treat feet, ankles, all those ugly little toes, but I'm treating a whole person. You know, I love communities that reach out to me. I want to treat the patient with dignity, equity, and respect. And what does that look like? You know, what I would prescribe for my mother, I'm going to prescribe for you. And I've been pleased. We don't always hit the mark. Doctors, we're you know, we have the pressures of seeing patients at a certain time, your boss is this, and sometimes we miss the mark, and that's just reality. But overall, I would like to hope that the patients that I've treated in my lifetime, I'm still in touch with some of them who will say, "Hey, doc," you know, somebody's like, "How's your mom and dad?" My parents have come into the office, made chit chat with patients. I've had one of my patients talk to my dad about diabetes after him losing his foot. So it's almost like a full circle. They edify me, and I edify them.
That's great because you talk about these principles. How big were your parents in the building of your values?
They're gonna love this when they see this because you're never gonna let them. The head is gonna go. So my parents are immigrants from the Caribbean, naturalized citizens. I know that's a big thing these days. My mom went to London to be a nurse at the age of 17. And when you think about leaving a country in the Caribbean going to London, there was a big push during that time to have nurses in London. That's a big deal. That's a kid saying, I'm ready to take on that. My father went to Canada and went into McMaster University. That's a big deal going from a warm country where people you know and see to a country that's freezing, both Canada and then London at times, and being successful. So they always pushed that education was non-negotiable. Non-negotiable. I remember I'll tease my dad. I think we were getting pancakes or waffles one day. My dad's making us breakfast and he was making us do timetables before we got them. What? Like I can laugh at it now because it's funny, but he was always motivational, like, come on, come on, come on. So, and they led by example. My mom went back even when we were like I can't remember what grade we were in. And she ended up doing more in nursing, getting her advanced degree. And it was always a marker that don't stop, keep moving because you can. And that
Mm.
motivated me and my sister. My sister became Harvard trained attorney, and you have me. So I think they did well, motivating us to keep pushing and motivating our other family members and friends. That we have great friends who do, like you, Wendell, who do just as well.
Well, that's great. So your work ethics, all these fundamental values have come from not only your parents leading by example, but also you taking that and making it to yourself. And I can see why you're so passionate about health equity. But in order to fix this, we must know what the problems are.
Mhm.
And I wanted to ask you, since you've been involved actively in this, what do you think is the biggest opportunities for healthcare equity?
I think understanding that maldistributed power, who sets rules, payments, and data are big. And that's not a Republican, independent, or Democrat thing. We won't even get into that. That's a medical thing. Clinicians want to give good care, but you can't do that without fair coverage. How does the patient get to you? Transportation, language access. We Spanish speaking patients, Russian speaking patients, Chinese. I'm in the Northeast. We have it all, and digital access. I mean, the fact that we are getting AI is a big part of what we do these days, making sure that people understand that how does that translate into effectiveness. There's also implicit bias. Sometimes I see, and this is not my opinion, studies have shown that we are in a first world country, for example, the obstetrics, the maternal fetal rate for African Americans is high in terms of death. Why is that? Cardiology, women having heart attacks that are not atypical. I should say they are atypical. They don't present like a man, and people misdiagnosing that. Pain assessment. There's been a study that doctors didn't believe pain from people of color. Why is that? Those are implicit biases. And until we educate each other, we do better. Utilization management, which is the prior auths, which doctors hate and the patients hate. When medical necessity is filtered through biased data or data that maybe it's just not being translated well from the physician, you get denials, and that harms the patients. And then communication. Patients wanting to feel that they're heard and they're valued. Sometimes we miss the mark as physicians. I will defend doctors and say we are human, but I defend the patients as well and say they're human. So there has to be a good bridge between us, and then having the insurance company be the other bridge, and understanding what we're doing to try to treat the patient to the best of our abilities.